Eating disorders. Many people eat almost every day. We have been having breakfast, lunch, and dinner with family and friends for a long time, and we have lived. In addition, there are various kinds of meals such as Japanese food, Western food, Chinese food, etc. And I think that there are people who are always looking forward to eating food. But do you know that there are diseases that they do not be able to eat as they think? We call these diseases eating disorders. These diseases are caused by thinking about body weight and body shapes too seriously, and they are occurred all over the world and there are many patients. So I'd like to talk about an overview of eating disorders. I'm going to talk about eating disorders. Eating disorders are influenced by excessive attention to body weight and excessive self-evaluation on body weight and body shape. Eating disorders are mainly classified into anorexia nervosa (AN) and bulimia nervosa (BN). Anorexia nervosa is divided into restricted type that thoroughly defecates and eating discharging type trying to maintain low body weight by vomiting or laxative. And bulimia nervosa refers to a symptom that they overeat and consequently does not lead to losing weight. In addition, there are also the possibilities of leading to an unspecified eating disorder not otherwise specified, EDND. Eating disorders are caused by physical and mental factors that influence on each other and cause abnormal eating behaviors. I'm going to talk about patients of them. The number of patients with eating disorders in Japan was 26,000 in April 2016. Among them, the rate of females is as high as 90% or more, and the rate of teenagers tends to be more likely to develop. This means that models and athletes are required to lose weight due to their skills and occupational reasons. In Europe and the United States, the rate of anorexia nervosa is higher in females, and the rate of bulimia nervosa tends to increase from their 20s. Among them, there are regional differences, 2.5 times higher in the city than the countryside, and nearly 5 times in the big cities. In addition, adolescent girls tend to develop more easily than adolescent boys. I'm going to talk about these factors. There are four main factors: social and cultural factors, psychological factors, family environment, and genetic factors that cause eating disorders. In terms of social and cultural factors, dissatisfaction with their weight and body shape and dissatisfaction with their figure affects eating behaviors. Furthermore, as Westernization advanced, praising that they were thin, a society that disdained obesity was formed. As a result, advertisements to become slimmer in the mass media and magazines were made, and it made societies and cultures that make slim popularity. Also in Japan, the average weight of women in their 20s has drastically decreased, and it has reached a step before 10% of the standard weight. About psychological factors, anorexia nervosa is thought to be related to compulsive personality tendency, perfectionism. Stresses caused by not being perfect affects eating behaviors. Bulimia nervosa is caused by depression and anxiety about their own weight. In addition, psychological symptoms are caused by depression, anxiety, embarrassment, psychological fluctuations such as depression of self-evaluation and obsessive compulsion. Family environment such as parent dissatisfaction or poor contact with parents, such as their parents' separation, may cause eating disorders. Furthermore, excessive stresses trying to answer high expectations from parents and biased child care system also contribute to abnormality of eating behaviors. Also, the load due to starting to diet by the whole family, critical comments to family meals, body shapes and weight may also increase stresses and lead to eating disorders too. In genetic factors, anorexia nervosa is known to have a higher heritability than bulimia nervosa. Also, it may change from anorexia to bulimia in the middle. And next, I'm going to talk about these symptoms. In specific symptoms, there are mental symptoms, behavior abnormalities, and physical symptoms caused by eating disorders. About mental symptoms, social isolation, depression, anxiety, obsessive compulsive symptoms, stubbornness, and perfectionism occur in anorexia nervosa, and behavior abnormalities such as abuse of laxatives, making it impossible to go out, sticking abnormally to the numeral value of their weight also occur. In bulimia nervosa, depression, anxiety, easy movement of mood, impulsivity occur as mental symptoms, and fasting, diet, restriction, loss of control of eating occur as behavior abnormalities. Common to the two, symptoms such as use of alcohol, self-destruction such as drug abuse, and shoplifting are also seen. About physical symptoms, in anorexia nervosa, malnutrition and influences of organs by laxatives occur, and in bulimia nervosa, discharge actions occur. Next, I'm going to talk about these treatments. There are three cures for eating disorders: outpatient treatment, hospital treatment, and medication treatment. In outpatient treatment, in the case of low body weight, it is possible to increase the dose step by step, taking 3 meals regularly. Also, when listening to the thought of a patient's anxiety and obesity fears may be eliminated. In the case of bulimia, relieve cognitive distortion of eating using interpersonal therapy. For outpatient treatment, psychological supports from their parents are needed for the long term. In hospital treatment, patients and their families are combined to thoroughly discuss certain achievable therapeutic goals so that they are convinced. If it is remarkable, they need to try improving nutritional status and cognitive behavioral approach. It carefully responds to psychological conflicts and behaviors, but it may take more than a year for judgment and 4 to 5 years or more for treatment. In medicine treatment, antipsychotic drugs are used for anorexia patients to alleviate the morbid obesity fear and help increasing of body weight. Also, it is necessary to use gastric emptying potential to relieve discomfort and feeling of upper abdomen. For patients with bulimia nervosa, SSRIs are used to reduce overeating. And for both treatments, it is important for patients that doctors do not keep on administration continuously. Eating disorders gradually recover as they tackle properly for treatment, and it is important to make regular meals so that normal feelings of hunger and satisfaction can be maintained. In addition, it is also important to notice the habit of negative thought on their weight and body shape and to relieve hidden stresses. If you cannot relieve stresses, It is important to find counselors or not to give up so as to be defeated by disease. In addition, acquiring control of negative emotions such as anger and sadness through interpersonal relationship approaches improvement of eating behaviors. Finally, eating disorders are classified as anorexia nervosa and bulimia nervosa and are now problems all over the world. And there are many factors and treatments. I think that it is important to face eating disorders without giving up, treat them, and be able to take good meals again. Thank you for listening.